Whether people have abdominal complaints or we're trying to check out preventatively how someone's gut microbiome and how their health is, one of the tests that I sometimes look for is called a SIBO test, which stands for small intestinal bacterial overgrowth. This can either be done because I suspect what's going on from their symptoms of abdominal bloating, and I've looked for other reasons for these abdominal cramps and they've come back normal, or during another stool test, if there's a lot of methane that shows up in the test results, then sometimes I look for sources of that, and SIBO is one of those sources. The SIBO test consists of a breath test, and the breath test is an indirect measurement of the presence of this type of bacteria in your gut that produces a lot of methane and hydrogen. The test is done by drinking a 1 to 2 ounce cup of lactose, which is a sugar. The bacteria in the gut metabolize that lactose and produce, if they are SIBO bacteria, they produce an overabundance of methane and hydrogen that are then measured in several tests that you breathe out in. So you may breathe out into this device at the beginning of your test, take the drink of lactose, take another breath test at 20 minutes, 40 minutes, 60 minutes, 1 hour, 2 hours, 3 hours, or some type of timing. And this breath is nothing more than inhaling and then exhaling into a tube that fills up a test tube. Very simple. The preparation is minimal. There are certain things that the specific test kit may tell you not to do for the day or two before the test. Read those instructions carefully, making sure to collect the samples as stated, label them appropriately with the timing, and send them back to the lab. No needle stick, no collection of other things that may be uncomfortable, just the drink, breathing into the tube over approximately 3-hour period of time, and it must be within a certain strict parameter. Otherwise, the data is not as valid. So make sure you have that 3-hour block of time to do the test. And the interpretation, which is relatively easy, would then permit your physician to give you a course of action, whether it is dietary changes or the use of supplementation, to help rid yourself of that small intestinal bacterial overgrowth, and then ultimately the symptoms you were having that brought you to the physician to begin with.